Namhlanje iPhumlani Dube Show ikwaMashu esinqawunqawini kwaMashu kwa-D uWard 104 eThekwini egagasini itheku likaBhanana. Sila uzobungaza i-Eye Care Awareness Month ehambisana nokuthi ngale kwaKuthangi kade kuyi-World Sight Day. Indaba enkulu ukuthi abantu bazohlolwa amehlo, ngemva kokuhlolwa amehlo bathole izibuko, ebese bethole izibuko bathole nama-wheelchair nama-walking stick abawadingayo. Konke lokhu kwenzeka mahhala usende. Umsebenzi wePhumlani Dube Foundation nophathina ebambisene nabo kulo msebenzi omuhle kangaka wokufukula nokuletha usizo emphakathini yakithi. Asibabone. Eduze kwami ngino Abed Karim wakuyona ke Al-Imdaad Foundation. Isiteketeso sakhe isikhwishikhwishi ngoba hayi impela uzombona ekhwishiza ngaphakathi. Abed, greetings.
Greetings to you, Phumlani, and wonderful to be interviewed by you.
Tell me about Al-Imdaad Foundation's involvement in this project.
Now, we once again say thank you very much to your initiative as the Phumlani Dube Foundation and bringing all the role players that you mentioned earlier on in terms of taking care of the eyes of our elderly and the community. Being the Eye Care Awareness Month, the Al-Imdaad Foundation has a program known as Vision for Life. And the Vision for Life has been running for the last 7 years, and we also have seen many patients who are in need of glasses and primary eye care. Today we are here to support this program of all the role players, a coalition of all these people that have come together to assist our community here in KwaMashu in Ward 104 in P section. And the reason we have also come here as Al-Imdaad Foundation as part of Vision for Life is to come in and support and help and make sure that we can add some value with the Phumlani Dube Foundation and all the role players, the Tekano Health, Provincial Health and everybody else to add a little bit more value to the project that is continuing today.
And tell us about the importance of eye health. Why is it important to take care of your eyes?
The Al-Imdaad Foundation had noticed over the years there were many members of the community contacting the foundation and say, can you please assist us with operations of cataracts, etc. And we did our research and we looked into it, and our founder and CEO, Mr. Yaqub Wahid, has said, you know, we need to start our own Vision for Life program and start with the basic checking of eyes, and from there have the cataracts operations. So in line of that, the Al-Imdaad Foundation has had an MOU with Department of Health, with the provincial government, and of course not forgetting the interaction between McCord Hospital, who is the eye care hospital here in KwaZulu-Natal. And so far we have done over 60 cataract operations. To answer your question, Phumlani, with regards to how important the eye is when I got involved with the Al-Imdaad Foundation and spearheading the Vision for Life program, we realized that a cataract operation takes only 15 minutes. And you could save that man's life or the lady's life, Umkulu's life, for the whole part of her balance of her life. And if it's not done, she can get blind for that whole life. And we have saw some successful programs when we did the program in Dundee, Mzanyati district. Ukoko was 104 years old. When we removed the cataracts with our partners from Turkey, and when she saw her grandchildren first time, she just cried and said that today I can actually see my grandchildren, and she held them. Can you imagine that feeling that you and I and everybody of us are making a difference and adding value to the community and our grannies, our kokos, our mothers and fathers?
No, absolutely. Thank you so very much. We are glad to have you as a partner, and we look forward to a long-term partnership with you. It's a very fruitful one.
Thank you, Phumlani, and again to your foundation, bring excellent work to the Department of Health, to the Tekano Department of Health, and all the role players. I always like to end with this quote of our founder and CEO, Mr. Yaqub Wahid, who always said that in working together, there is no limit in what we all can do in striving to serve humanity. Phambili Phumlani Foundation, Phumlani.
Phambili. Siyabonga. Tell us about the importance of Eye Care Awareness Month, the importance of eye health. Why is it important to take care of your eyes?
Thank you, Phumlani. Eye Care Awareness Month is celebrated throughout the world, and World Sight Day was in the last week. So we saw people across the world coming together to increase awareness through screenings, testing campaigns, spectacle provision. Why eyesight is important and eye care awareness is important is because for the longest time, eye health and eye care has been seen external to general health systems. So even in world policies and even in South African policy, you have your general health policy and then you have your eye health policy. Over and above that, the way the policy is structured is that there's a disconnect between the policy and the programs and the actual delivery on the ground. And there's also a disconnect in how budgets are allocated towards where eye health services are positioned. So in South Africa, eye care is broken up into two parts, which is your vision and then your eye health. The eye health care part is shared by many cadres within eye health, which is your GPs, your nurses, ophthalmologists and others. Your vision is dealt with predominantly by optometrists, and they are an educated and trained cadre of healthcare providers, and they specialize in the vision and eye health. Right now, South Africa is in the fortunate space of having optometrists be able to practice at the highest level of optometry, which is to be able to provide refraction services, which is your spectacles, to be able to diagnose some eye conditions and to be able to manage them therapeutically as well. The unfortunate thing is that the way the profession is advanced is not aligned with the space that's available in the public sector. And one of the fallbacks is that many people, like we see today, queue up at every awareness and every wellness event, and the eye care queue is always the longest queue. And that in itself is a big red flag for us to say that this is an undervalued area, it's an underserved area, it's an area that hasn't been given the priority that it needs to be given.
Hasina, you have worked with the Phumlani Dube Foundation and the other partners in taking eye care education to various communities in KZN. What has been your experience so far? What are the issues that keep coming up, and how have they been addressed?
So we've been doing this for about 5 years now, and what we find is the commonest occurrence is that people don't know where to go to get their primary eye care. Most people believe that eye care is expensive, especially when it comes to spectacles, and it's money that they don't have because the grant system doesn't allow for that many privileges basically to be afforded, especially when an elderly person is using their grant to run an entire household with little children and many dependents. We've also found that besides not knowing about eye care or where it can be found or the fears around cost, we also realize that patients tend to be confused about who the eye care providers are and who they should be going to as their entry point of care. So there's a lot of gaps in terms of where we're at. But the biggest gap that we found is that people don't even know that eye health and eye care is part of their Bill of Rights. It's what they are entitled to. And for this year, our campaign is #MySight, We've asked people across the country to drop their pictures on their own social media platforms using their spectacles to create an awareness of how many people actually need spectacles and why it's their right. Without those spectacles, you're not able to perform well in your daily functions, which include safety, education, and participating fairly in the economy.
Namhlanje njengogogo nabantu abasha babacabangelile o45 kuya phezulu. Into engiyilindele ukuthi njengoba sengififiyela nje ngithole izibuko ngaphinde ngawe ekhaya egcekeni sengithole nehostik manje sengikwazi nokugiya nje ngayo ngidondolozele. So gogo into engiyibukile la sisamile nje akolayini sitezi kahle siphatheke kahle into engiqaphelile ogogo bajabule khona abanye ogogo nje ababili obubabona ukuthi bathwele kanzima abathola ama-wheelchair, sesithola amahostiki, sithole iy'buko, usaqhubeka nje umkhankaso. Okunye-ke iPhumlani Foundation ave ngiyithanda ngoba mina ngomunye wogogo futhi asijimisayo. Sine-group nje ama-fit gogos aphethwe uyena ubaba uPhumlani. Sizamile nathi ukumlekelela, sabatshena nomakhelwane. Khona omakhelwane nje abasuka le eNewlands abathe cha uMasha uNewlands ayibaliwe uMashu, nathi siyakhona. Phambili ngesinqawunqawu phambili ngoPhumlani Foundation, phambili ngama-fit gogos. Siyabonga kakhulu.
Igama lami ngulindeni nokaQwaba engihlala ku-Ward 46 ukhansela ubaba Mazibuko. Ngithi ngicela ukubonga kakhulu kuPhumlani Dube Foundation ngokuthi asixhase asiphe iy'buko zamehlo sahlola mahhala sadla namafuthi mahhala. Ngicela ukubonga kakhulu ngoba kade ngangiyidinga iy'buko ngingakwazi ukuyithola nganayo imali kadokotela. Ngithi kwande Phumlani Foundation siyabonga kakhulu uSiphathwa KwaMashu.